Hello there, my name is Corey Durbin, CEO of Shared Health Alliance, and I'd like to welcome you to Running Eyes, a podcast where we take a meaningful, deep dive into the relationships, strategies, and global mission of ASH to change healthcare and change lives. Well, I have the good fortune today to be joined by Dr. Cristin Dickerson. Dr. Dickerson is the founding partner of Green Imaging, and she was born and raised in Texas. She's a graduate of Baylor University and the University of Texas Medical School at Houston. She was elected Alpha Omega Alpha Honor Medical Society there, and she practiced 13 years at a diagnostic clinic of Houston, or the Diagnostic Clinic of Houston, where she served there as a two-term president of a fairly large physician clinic there. Dr. Dickerson, it is great to be with you. How are you today?
I am very well and excited to be here. Thanks for having me.
Thank you for taking the time. Yeah, absolutely. Thank you so much. We appreciate the impact you and your team have on the Alliance for Health members, and looking forward to sharing a little bit more about your background and hearing more about your background today. So you founded Green Imaging, of course, and that was after your time at Diagnostic Clinic of Houston, correct?
It is. And it was directly referable to that opportunity I had at Diagnostic. The irony is that I went to Diagnostic Clinic of Houston because it was a multi-specialty group. So I would never have to get into the business of healthcare. And a few years in, we had a new billing manager who brought me a big box of what we call yellow tickets. And they were the charge tickets for all the work we did nights and weekends, all the stuff I did on call that took me away from my family. And the hospital wasn't giving us enough information to bill those. So we had literally what was probably millions of dollars of yellow tickets sitting there that we couldn't bill because of that, because that relationship had not been optimized. And wow. That motivated me to come to understand the business of healthcare. And it was really kind of my MBA. As president of the clinic, I had a CEO and a CFO, and, I learned about profit and loss and, all the business reporting. And really also, we were a self-funded healthcare. We had a self-funded healthcare plan. And so we, even back in 2003, we were incentivizing our employees to use our own services rather than those down the street in the med center, to keep them out of our Blue Cross Blue Shield, plan, and thus, save money and save on our premiums. And it was very successful.
Well, I would say that in general, and forgive the stereotype here, but medical practitioners are not necessarily known for their business acumen, right? Because they're so busy practicing. And what I know about you is definitely an aggressive risk taker. So I would imagine stepping out and going into and starting Green Imaging was a little bit scary at first, or was it did it feel really natural as you started out?
I was really lucky. And when I left Diagnostic, I went to another similar practice, Medical Clinic of Houston, which is another very good multi-specialty group here in Houston. But they were not interested in having a radiologist as a partner, the way I had been at Diagnostic Clinic. They wanted me to be, just a contractor, which was fine, but it also was not the way that, I have a lot of creativity and a lot of business acumen, and I wanted to be able to use this. And so I started Green Imaging as a side gig, while I was, practicing full time as a traditional radiologist. And, it wasn't until February of 2020 that I went full time with Green Imaging. So it was really, there wasn't much risk. It was just, this idea that I had to save, people who didn't have health insurance, people who had climbing deductibles. And I always knew I could save employers money. And so, just kind of gradually grew it. I fortunately had a, full-time radiologist income coming in. And so I didn't feel like there was the risk that there would have been had I started an imaging center or a chain of imaging centers that were brick and mortar.
You got to develop it a little bit at a time, that's certainly a nice opportunity, a nice way to get started if you can. And you had a background also at MD Anderson at the Cancer Center. And was that really previous to or prior to the diagnostic clinic?
Yeah, a significant portion of my training in radiology was at MD Anderson. And so I, that was a 4-year experience. So I would say probably a quarter of my time in residency was spent there training. Wonderful place to train.
On the clinical side, do you tend to lean toward or gravitate toward the cancer side of things?
Yes, my price, still my practice isn't it? And that is not a cost effective way to practice medicine. I read these PET CTs, with people who've had 5 prior PET CTs and have to compare them. But I get a lot of personal gratification from working with these facilities and patients. So yes, I would say probably over 50% of my practice is oncology.
Okay. Well, what is it about that side that is not as profitable in general? Not understanding
the time
that side on my side. Okay.
Well, that's an interesting question. It is that we get paid the same to read a study, whether it's normal or if it is unbelievably complex. And we get paid the same to read a study, whether it has 10 comparisons or 0 comparisons. And so it's the time it takes, to read these exams and the level of complexity of the reporting when you're dealing with cancer.
I see. Okay, that's helpful to understand. Thank you. One of the things I always like to learn from our guests is how they got into the profession or career. So was there something growing up? When did you decide you wanted to become a medical practitioner?
I guess when I was in college, I did a summer internship with a radiology practice at St. Joseph Hospital here in Houston. And I cleaned up their teaching files. And I had a great mentor, and it was just a wonderful experience. And I think that was probably the turning point there. Gotcha.
And so my hunch is you really definitely believe in what you're doing. And is that, this is a silly yes or no question right now, but am I on track with that hunch? You feel like you're in the right place at the right time.
I do. I feel like I'm blessed. And, I actually was part of a conference a few weekends ago called Innovator MD. And I was trying to all these physician innovators speaking, and I was trying to put my thumb on what was so different about that conference. And I figured it out. It was that these were the happiest doctors I have ever been around. And so I think actually the pandemic has allowed so many physicians to spend their, the time that they're not with patients, which is quite a bit right now, being innovative and solving problems. And it was really an amazing event.
In fact, I was aware of that event and ended up having some other obligations come up. We had one of our other partners, at Giuseppe, I think, was part of that. Do you happen to know the folks at Giuseppe at all?
I have just been made aware of them. I just spoke with them last week.
With Tushar, possibly?
No.
Maybe not. Yeah, well, that'll be an interesting connection, and they've got some really kind of new things brewing with them too. So I think that will tie together as we go along. So back to this green imaging, and can you talk just a little bit about how what you all do impacts the members, the employees of self-funded companies, of anybody that would be directed to utilizing your services?
Yeah, let me tell you a story about School District of Osceola County in Florida. This school district, the students are considered to be 100% economically challenged. And the faculty or the employees' wage increase in 2019 was entirely wiped out by the increase in their Cigna premium. And so the teachers union went to the school board and said, these people are paying all this money for this health plan. And they can't afford health care. There's no money left over to pay for care. And, we call that being functionally uninsured. And so the school board had to do something. And so and I'm sure you've heard of the Rosen Health Center Harris Rosen, who owns hotels in Florida, many, many years ago, threw out his Blue Cross Blue Shield plan and just built his own healthcare plan and his own health center. And it's not just a clinic, it's a health center. They do infusions, they do therapy, they do all kinds of things. But he, is in that geographic area, and he heard about this and he volunteered for his clinic, his health center, to be the near site clinic for School District of Osceola County. And so the school board offered that to the employees at zero out of pocket. And then they offered green imaging at zero out of pocket. And we had predicted that we could save the school district $1.3 million in a year's time. And, we had a slow ramp up at the end of 2019. We got off to a booming start in 2020, and then the pandemic hit. And, we took great care of their employees. We had to do quite a bit of counseling on, should I be getting this exam? What is essential imaging? We had to assure them of the safety of these outpatient imaging centers, that, they're as safe as they can possibly be. They're screening out COVID patients, doing temperature checks, disinfecting the rooms between patients, no extra people in the waiting rooms, spreading out exam times so that people are not overlapping. And so it was a big year. And we were also able to leverage their 10,000 members to get better pricing in the area. And so we ended up saving that school district the school district and its employees $1.5 million in 2020, despite the pandemic. And, like my partner said when we were discussing it kind of as a company and the social value of working with a school district. And the really great thing is that's not just about the employees, that's about the kids. And when I was on the Innovator MD conference, somebody went and I told that story. Somebody put in the chat that, they had a school that had to be closed in their district, and that might have made the difference there. And so, it's really, when we can get social value like that from working with clients, it makes it fun for everybody to go to work every day.
Yeah. And I think that's such an important part of what we all do as, the support that we do for Alliance for Shared Health as a vendor consultant, or the vendors that we bring in, like green imaging, and the impact that you have. Because really the idea is we all have to be in this together. And it's not just, some government mandates or, all on the providers or all on, the employers or some faulty system. We all have to figure out what role can we play. And sometimes that means being innovative and willing to take different approaches. And sometimes that's not easy to do in the public sector, but it sounds like you all really made some significant inroads at that school.
And the private sector is much easier to work with. I'm contemplating right now, there's a Japanese study that just came out in the American College of Radiology Journal about using PET-CT. The Japanese, when they were able to open back up, there had been about a 1 year pent up demand for healthcare. And, employers were really worried about that, the long-term effects of that on their workforce and financially. And so they implemented a PET-CT screening program for patients above a certain age. And it ended up being cost effective. Last year, I think it's 58% of women didn't have screening mammograms. And so I'm going to continue to follow this and see if when things open back up, if that's something, employers need to consider here. We're going to have there are going to be real healthcare ramifications of, the relative shutdown that we've had from a healthcare standpoint.
Right. And you brought up the idea of you're going to kind of pay attention to this and continue to monitor that situation. I think I'm assuming you sort of had the opportunity as you grew green imaging to do a lot of thinking. And I don't see you as a person that sits still. You're innovative, constantly looking for new ways for your company to do business. And so I'd ask you, what else do you kind of have in the works for where you all go next?
Well, we want to get this out as, everybody talks about, how big do you see this getting? And I only want it to get as big as being able to continue to offer the same high quality service to as many people as we can, but I don't ever want that level of service to to decrease. That would be a shame. And so, right now we're trying to keep up with the organic growth. But the ideas we have, there are a lot of, we've got an enterprise level referral management system that is really helping us become more efficient. And 85% of our patients are now scheduling themselves completely by messaging, by, what appears to them as a text. It's actually a HIPAA compliant secure message, but effectively they're texting us. In less than an hour, they end up with a voucher. They're scheduled for their exam. They have the prep, they have the address, they have all the information they need to go get that handled. So the more that we can make healthcare easy, we're always looking for ways to make healthcare easier for people. When we can get the auths and the verification of benefits, and, when we can get all that noise out of the system, healthcare is really easy. Our old tagline was the same high quality medical imaging at a fraction of the cost. Now it's easy, affordable medical imaging, because if it's implemented appropriately, it is just so simple. And a lot of patients will use us just, even if they have insurance coverage, just to get that noise out of there. And again, Cigna is really proud that they deny auths on about 50% of MRIs. Well, those patients, of course, head our way for, as self-pay patients. Many of them have significant pathology. I think as many as get auths. So, certainly, that's a model. But the things we're looking at, of course, machine learning and AI are possibilities. There's a very interesting project that we're doing with Subtle MR out of Stanford, and it is not AI in interpretation, which is what we frequently hear about with imaging and AI, but it is AI applied to a machine and applied to to an older MRI machine, and it turns that machine into 3T quality images and decreases the scan time. And so obviously that increased throughput makes that imaging center, able to, it can help them drive down the cost of care. And, certainly right now, where imaging centers were 3 months last year at 50% capacity, they need that revenue as well of the increased throughput. So, I think that's a really interesting thing that's evolving. As far as payment models, we're looking at the payment model is still broken in healthcare, in health plans. I have so many clients who really want a HICFA 1500 claim form to go through a clearinghouse. They take 45 to 60 days to pay, all these things that really make it very difficult to streamline operations. And so there are certainly some payment solutions that are coming out, whether that's blockchain or just, an escrow account. There are all kinds of solutions that are emerging to get payers, to get providers paid more quickly. And then, the other thing is models, whether that's capitation, whether that's bundles of imaging, whether that's futures of imaging. All of those things enable us, improve cash flow for practices. Certainly we were at 50% capacity in March through May. We were able to keep our workforce intact, and we actually added, I think, 12 jobs in 2020. So, we pulled out of it very strong from a financial standpoint, but it certainly would have been nice to have more capitation or more, cash flow coming through, in kind of a catastrophic situation.
Yeah. Well, going back to the AI that you referenced, if I'm understanding you correctly, then for an imaging machine that may be older equipment, does the AI actually allow that older equipment to continue to be functional at a high level, or is there more to it than I'm understanding?
No, it actually, improves the, the image quality and decreases the scan time. So here's the way this works. Typically, let's say on average, there are 6 sequences acquired in an MRI exam. The magnetic fields are applied in different directions to elicit signal properties of a specific type of tissue that differentiate it from another type of tissue. And that said, what the subtle MR does is it takes the first 3 of those sequences and reproduces, reconstructs the other 3 sequences. So they don't have to be acquired. They're actually reconstructed. And so it is FDA approved. And the image quality, I don't think it changes. We know now, everybody thought 3T was going to be, the answer to it was going to be great. There are a few settings where 3T MRI is better. Mostly most of, the properties of the stronger magnet are used actually now to decrease exam time, not so much to improve image quality. So I don't think the images are any more diagnostic. They are prettier. There's less noise in the images. But certainly they're as diagnostic. And again, the time on the table, the decreased time on the table decreases, the patient's anxiety and maybe decreases the motion, just the natural motion that, we all get stiff if we stay still too long. So it enables the patient to not spend all that time on the table with that discomfort. So, there's some really great properties there. I would love to see that happen. I'm green imaging is green because we save money and also because we are, we're not putting in new brick and mortar. We're using existing resources. And if we can start to better use the existing equipment rather than, imaging centers having to upgrade, a $1.5 million magnet every 10 years, that's going to be a game changer, I think, for American healthcare.
Can't do anything but help long term with the cost, I would imagine.
Right.
I could relate a little bit to, I've said on here a couple times, my dad's going through lung cancer, and the whole idea of how the discomfort or kind of uncomfortable, same word, but going into the imaging and saying that kind of claustrophobia or whatever, and like that's very real for him.
It
for
is.
sure. Not an easy thing to deal with. But in terms of the impact to members, what is it about what you all do that helps get the cost of the imaging down? Can you just talk a little bit about that, and so our members understand the impact that you're able to have on their personal pocketbook?
Sure. In Texas, when we started this, we really turned radiology on its head. Typically, an outpatient imaging center contracts with a radiologist and buys the interpretation for that exam at a flat fee, and then the imaging center bills globally. What we did was the inverse of that. I looked around, and instead of building an imaging center, I had all these imaging centers that I was working for that were at 50% capacity. So the Stark laws actually specifically state that radiologists are consultants under those laws, and that they don't apply equally as they do to try to keep other doctors from doing lease arrangements. And so we are actually able to do per click lease arrangements. So we buy the extra time, the unused time on a scanner at a discount, and then we pass that savings along. So what we do is we pay the imaging center a flat fee for the scan. We read the study, and then we bill globally. So we're actually, making part of our income based on that radiologic interpretation. We're also steering patients away from, where's the most expensive place to get an MRI? It's down the hall at the hospital. 70% of doctors in the United States are, either employed by or subsidized by healthcare systems. When they give the patient a script for an MRI and say, step down there and let's get that scheduled, that's going to be the most expensive place. And so exams in the hospital systems are typically 3 times that in the independent imaging centers in a geographic area. There's a lot of market variability. Boston and Pittsburgh are hospital dominated, and probably the cost of an MRI there is 3 times that of an MRI in Houston, with the exception of at MD Anderson, which is equally expensive. But in our hospital systems, the MRI, non-contrast MRIs range from about $1,300 to about $1,600. In Boston, I see pretty consistently around $4,000 to $5,000. But our savings in those geographic areas are still about 2/3 that of the hospital system. So across the, depending on the city, it's going to vary dramatically, but it's still, when we look at claims data, we're still usually 1/3 the cost of, of the average in a self-funded healthcare plan. And, a small percentage of imaging belongs in the hospital. I would say 10 to 15% belongs in the hospital, whether it's pediatric that requires sedation, if it's an emergency, if they're extenuating, circumstances or if it's an unusual exam. Cardiac MRI is typically, always performed in a hospital system.
Yeah, I think the thing about Alliance for Shared Health, and as one of the original members of that health share myself, there's no doubt that the vendor selection and utilizing the services Green Imaging provides really is in alignment with the way ASH feels like it can best serve its members and share in the medical needs. And I think there's sometimes a little bit of misunderstanding from members saying, well, why can't I go to the hospital to get this service done? Well, the health share entity really can't absorb long-term the inflated prices that happen at the hospitals when those services can be provided at outpatient facilities or clinics. And so what you all do really aligns well with what the folks at ASH are trying to do and how they're trying to maintain a strong needs fund for its members.
Right. And, I'm all for consumerism in healthcare, but let me tell you, the system is intentionally broken. Coding and billing in imaging is so complex that it really takes me about 6 months to train a concierge and, for them to really understand how the CPT codes apply. We would love to get away from them, but we can't. And even if it's just for analytics, even if it's just to show savings. So an example is there's a code for bilateral hip x-ray, but breast ultrasound, there's no code for bilateral. So you have to charge unilateral twice. It's nonsensical. There is no logic to it. And it's intentionally that way. So, I do believe in consumerism, but, number one, that's an issue. Number two, equipment and quality of interpretations. I will tell you the biggest red flag is about an imaging center is if there's no mention of who their radiologists are on their website. But even so, there's really no way for the average person to know, really the quality of that imaging center. ACR accreditation is great, but it's a single point in time in every 3 years. That doesn't mean that next week those images are going to look bad. And frequently they don't. Frequently they bring in a consultant to help them get past, that accreditation process. So, we really feel like we're maybe 70% of the time we're reading the studies, which we're looking, we're seeing the reports, and we, our subspecialty radiologists are reading the exams. We see those images. We know if the tech's good. We know if the machine is good. And then if we don't read the exam, we actually have, ask for peer review privileges in our contracts such that we can get in and look at the exam and the report, even if we didn't perform, even if we were not the radiologist in that case. And so again, the fact that we're radiologist owned and operated gives us that advantage that we can go in and actually look at that study. And I've only had to invoke that once. And it was a patient during the pandemic who, or during the shutdown, really, who said that some of her images were fuzzy. And so it was the school district, and they said, would I take a look at it? I said, absolutely. So my neuroradiologist and I got on and looked at it. And, she had moved during one of the sequences, but we were able to say, look, this exam is normal. If you were a family member, we would not repeat it. If you would like to have it repeated, we can send you back and we can repeat that sequence. So I do believe in consumerism, but it's tough with imaging. We actually built an app so patients could self-schedule a few years ago. And what we discovered is 40% of imaging orders are incomplete or downright incorrect. And so patients were scheduling themselves for the wrong exams. It was a huge mess. And what we learned from that experience, like you say, I do like to work in the business. What I learned from that is we needed a super strong concierge staff, because when people are under healthcare stress, they really don't want to be consumers. They really want want hand holding. And if you look at our Google reviews, our concierge are almost always called out by name. And so I think that means they're doing their job effectively.
And I think, with the connectivity that we developed, Shared Health Alliance, through the Share mobile app, and what you have allowed our members to access, makes it really easy. We've used it ourselves, of course, to connect and get the labs and the tests ordered. And certainly an additional value that you all bring is to help that member to know that and have confidence that they're going to a center that they can trust. Am I saying that correctly?
You are saying that correctly. And we're very quick to remove centers from our network if they don't meet not only our quality standards, but our core values.
One of the things that you also hit on, I like to go back to just briefly is, it feels to me like doctors aren't necessarily getting to practice anymore. I mean, there's so much control that's happening. Why does a company like Cigna say, refuse 50% of the requests that come in? I got a call last night from a doctor friend of mine, actually from Scott Miller, who was on a previous podcast with us, joined us. He's a PA and has a family clinic up here in Washington, but he was helping a friend of mine who had developed COVID and was having lung issues and prescribed him budesonide, and Cigna was not letting him get the med. And so, he fought for him for 2 hours, finally got it approved, but it's like, this is a $64 medication. When a provider is writing a prescription saying, my patient needs this. And so the question maybe I'm getting back to is, what is going on that a Cigna doesn't say, well, we don't want you to go to this hospital, so let's redirect over to green imaging and let you make sure that this is done in the most cost-effective way.
Well, I think those are the malaligned incentives of what, Carl Schuessler calls the cartel, the insurance companies, the pharmaceutical companies, and the hospital systems. And if you look up the definition of cartel, they actually meet it. It is their incentives with the Affordable Care Act plan. Their profit is capped at 20% of revenue. So do they really have, so these are two different issues really, but with the green imaging standpoint, they don't really have an incentive to hold down the cost of care for the employers or the employees. Their incentive is really to drive up revenue so they have more profit. And so that's one answer. I think in some way they have to show or to demonstrate something from a fiduciary standpoint for employers that they are doing something. And so, I think, redirecting, not authorizing the MRIs, they understand that a lot of patients will just go ahead and have it out of pocket. So that is, that's one means that they use to kind of prove to employers that they're doing something. Probably the example of the medicine as well. We've got these safeguards, quote unquote, in place to make sure these nasty doctors aren't abusing the system or something like that. That's the best I can do with it.
Yeah,
and we're only 7% of healthcare costs, physicians. We're not the big driver.
It's not the docs. It's the facility charges for sure. And I appreciate your comments on that. I'm curious a little bit about you all as a company are taking care of our members, taking care of your employees. What about you? What do you do for yourself to take care of yourself?
I am a competitive tennis player, and I have played tennis for longer than I care to mention. And I still play probably 4 days a week and compete. And then the other thing that I implemented during COVID was, I feel like I sit in front of a computer all day. And so I am actually walking an hour a day. And that's what I do. And we've always eaten healthfully.
So competitive tennis, is that in your history, like college and through the ranks, or what?
I played juniors. Yeah, I played juniors. I play at the second highest level in Houston. So, there are two levels of open play, and the top level is you usually have to have a couple of pros on your team. Our team does not have any pros, and we play that second level.
Oh, very cool. Well, the COVID's been an interesting time for sure. And you're right. We all tend to end up at our computers a lot. The impact that you talked about your growth and your company's growth, and certainly Shared Health Alliance saw similar in this past year. And I think people are looking for alternative ways to access care. And I know you're a big promoter of that. And because of what's going on in health share, there's all kinds of regulatory push. Insurance companies don't like health share entities because they don't like that the rules created a safe haven for health shares. And at the end of the day, the consumers really need these choices, and we appreciate that you're helping create a way for our members, for ASH members, to be able to access care at a more reasonable price. And these kind of alternatives, I think you would agree, really need to be part of the marketplace.
Oh, they do. And, my husband and I have been experimenting. I think our last year with United Healthcare was maybe 5 years ago. So we've been on several alternative plans and had good and bad stuff happen along the way. But I think we've probably saved over $100,000 despite a couple of surgeries and that my husband had for kidney stones. And we've done, it's been great for us. It does taking a deep breath and cutting the cord. But, I'm from personal experience, I couldn't be up here talking about this if we weren't doing it.
Yeah. And it's saving the money doesn't come without learning a new way to do things. And I think that's true when a patient or a member says, how do I access imaging tests at a lower price? How do I access, the virtual primary care providers? How do I go get a high cost medication like is offered through Sharks, where we go get these high cost specialty meds or maintenance meds, typically at no cost for members. And those things do take some effort that people in general are used to being able to just say, here's my ID card, and
right,
don't have to think about it. And that world doesn't allow somebody to reduce their costs. It does put some onus back on all of us. But you've made it a lot easier for our members through the connectivity that is provided through the Share app. And I really feel like we're on the right track with our connection with you all. And if there's anything we can do to have a greater impact, we sure want to know what that is from you.
And vice versa. We love working with you.
It's been great to talk to you today. Of course, our members, hopefully they know that they can connect to Green Imaging through the Share Connected Care, through the Share mobile app, through Share Imaging there, and something that my family and I do. And again, thank you for taking the time today. It's a blast. And I know this will be helpful to the Alliance for Shared Health members to understand more about how Green Imaging will help keep their medical costs down.
Right. Thanks for having me, and stay safe.
Cristin, have a great day. Appreciate it. See you next time.
Well, there's so much there as I talked to Dr. Dickerson, and there's such a balance between the kind of the clinical technical side of things and how to just convey to members of Alliance for Shared Health how to access what's available to them through Green Imaging. And I am hopeful that there is it's clear that how passionate Dr. Dickerson is about what she does, and the great impact that they can have on members' out-of-pocket costs. And hopefully it's also evident that it's really easy to use through the Share mobile app. Those conversations are valuable to me. I learn something new every time, and it was really enjoyable to get to spend the time with Dr. Dickerson. And I hope it brought some insight and revelation to you as an ASH member or as a potential member. So I thank you for your time. As always, I look forward to being with you next time.